So I'm from India, and we have a very small pediatric palliative care unit in the Tata Memorial Hospital, which is where I'm from. And we've been working for the last 10, 12 years to disseminate the interesting and informative part of children's palliative care. But the biggest barrier that we face, I think, is that for India, when we ask the health system what are their priorities, for them priorities have always been maternal and infant mortality. And they always tell us that if within the health budget that we have, these are always going to be our priorities. It's difficult to convince them that if you can help children who are going to die not so soon but in a certain period of time, and you can keep them out of ICUs, and you can actually help them to die in the environment of their choice, which for us would be home, actually we would be saving their exchequer some amount of money, and that money could be used towards children's palliative care. It's a very, very, very uphill task that we are facing. There's a lot of cultural differences in our country because we have many religions who all come together, and many of these, because there are so many religions, there are so many customs, rituals. Spirituality is different for the different religions and therefore for the different families. There are different types of families. We have nuclear families, we have extended families, we have problems of the girl child. Sometimes the girl child doesn't even come to the hospital. So these are a lot of difficulties which we face in India, and I think this meeting is going to be a real melting point because it's so important for us from different parts of the world. We have been very fortunate that Marutza Foundation has got all of us together and in such a historic place as the Vatican. And I think us meeting together, learning different approaches in the different cultures to pediatric palliative care is really going to enrich not only children all over the world who require this children's palliative care, but I believe that it's going to enrich us a lot, and we're all going to go back much richer at the end of this meeting.